Drowning is one of the leading causes of death for children in the United States. That's according to the New England Journal of Medicine.
In this week's California Health, 23 ABC's Scott Sheehan talked with the Department of Public Health about what they're doing to prevent children from drowning right here in Kern County.
My eyes are on them 24, in the house and outside.
Rita Garcia is a grandmother and great-grandmother with family in Bakersfield. She says when it comes to safety, she's always looking after her children. And she says there's no excuse for leaving your child unattended, especially near water.
I don't understand it. I just don't, because whether in the pool or not, I mean, I know accidents happen, but you gotta, kind of keep a eye of your kid every minute as much as like if they're in the pool.
So far in 2019, 23 ABC has reported on at least 6 drowning deaths. All of them were 16 years old or younger. 4 were 2 years old or younger and drowned at home. To try to reduce those preventable drownings, the Kern County Department of Public Health is pushing 2 programs. The first program, hands-only CPR. The other is Water Watchers, which designates an adult to watch swimmers in the water.
This lanyard goes around your neck, and adults agree to take turns every 15 minutes to wear this lanyard. Now, on this lanyard is a whistle. If an adult agrees for 15 minutes only to watch the kids in the pool, if something happens, all they have to do is start blowing this whistle.
Jeff Ferris says it's important to be watching and to be ready to act at all times when someone's in the pool, because you might not notice drowning happening if you're just listening.
When a child drowns, it's silent. They don't make any noise. The first breath they try to take fills their lungs with water, and that's it. There's no more sound. They don't splash. They're ultimately silent drownings.
If something does happen and CPR is needed, Ferris says CPR has to begin as soon as possible. And he says the best way to do CPR is using just your hands.
Every minute that passes without CPR, you lose 10% chance to survive. So the sooner we start compressing the chest and circulating the blood, the more opportunity we're giving that person to live.
If we have a drowning, we pull the victim out of the water, what is the next step?
First thing you want to do is see if they're okay. Are you okay? If they don't answer, either you yourself call 911 or you direct someone to call 911. You call 911. Third step you're going to do is start CPR. Put the palm in the center of the chest, straighten out your arms, and you want to do at least 100 to 120 compressions a minute. And you're just going to do CPR only until the person wakes up, until help arrives, or until you get too tired to do CPR.
Living in California with pools, rivers, lakes, and beaches nearby, Ferris says hands-only CPR is a skill everyone needs to learn. And Garcia thinks having the Water Watchers lanyard will help remind her what she needs to do in case of emergency.
Even though you're prepared and it happened, it's like everything you learned just went out the window because you're panicking. And with the whistle, trust me, I would be blowing it. But I think it's very important because, it'll help, it'll alert others, it'll alert the kids, neighbors,